Now, Executive Suites with WPRI.com reporter Ted Nisi.
Welcome to Executive Suite. I'm Ted Nisi. Later on in the show, we are going to talk about Granny Squibb, which is a person, though the Granny Squibb isn't with us herself. We're going to talk about the iced tea company that's been growing in Rhode Island. They have some new leadership taking the helm. We're going to talk about the business they're in and how things are going for Granny Squibb. But first, I'm very pleased to be joined by Dr. Angela Caliendo. She is the interim executive director of Brown Physicians, Inc. She is the vice president of Brown Medicine, which some of you might remember was University Medicine. They have a new name, and vice chair of the Department of Medicine at Brown University. Did I get all your titles, Dr. Caliendo? Yeah. Thank you for joining me. So some of those names in there are new to people. Brown Physicians is new, Brown Medicine is a new name, and I want to get people kind of up to speed about the institutions we're talking about here. We're taping in May 2018. It was about a year ago this month, I think. Brown announced it had there was a deal to merge 6 Rhode Island physician groups under this one umbrella called Brown Physicians. Why was that a big deal? Why does that matter to people?
So you're right, it was about a year ago when we all came together. And the purpose of coming together was to really allow ourselves to provide health care in a different way. So the way that health care is being delivered these days is changing. You know, people talk about moving from volume of care to value of care. And in order to really get to that value proposition and to drive quality of care, physicians have to be working together. They have to be aligned. They have to be looking at the patient not just from one perspective, but from all perspectives. And by us coming together, we really are under the same administrative structure, and it allows us to work together more effectively. It allows us to partner on clinical issues and really drive quality of care. So think about it, a patient has surgery and then they're discharged to their primary care physician. You know, having a better way to communicate that, making sure all the information goes from the surgeon to the primary care doc, really will drive quality of care for them.
So there might be, I can imagine, a little skepticism from some folks walking, because we've heard for a long time about the need for closer alignment across our doctors, our specialists, talking to our PCPs and all that. All the efforts on electronic medical records have been pitched on that, and they might say, people might think, well, this sounds like maybe you change the signs in the letterhead, but it's still the doctors in their different offices or whatever. What specifically are some of the specifics that you think can really make a difference for patients and for the doctors by having this one organization for all these groups?
So I think that, one, if we do this correctly, we're going to be able to practice more efficiently. And so we could drive costs out of care, so we can spend more of our resources focusing on patient care and what the patient needs for a good outcome, and less on what we're doing on the administrative side. So I think coming together allows us to really do more cost effectively in our administrative side. That gives us more resources to drive the quality of care.
That's interesting, because that's a perennial complaint on both sides. Patients and doctors don't love all the paperwork that comes with it. So you think you can streamline that a bit by being in a bigger group?
And I also think we're working together to think through things like access. You know, when a patient shows up in a specialist's office, how do we assure that if they need a primary care doctor, there's a very easy way to refer out to that doctor, get them linked into care, so that they're now in a primary care umbrella and not just seeing one specialist after another after another. And so these are the types of things that we've already started working on inside of the organization.
So give people a sense of the scope. Brown Physicians, as I said, it was 6 practices that were separate, are now under that umbrella. How many doctors are we talking about? What kind of specialties are involved? Sort of who we're really talking about here.
So we're talking about 500 physicians, and there's probably another 100 or so advanced practice providers, such as nurse practitioners and physician assistants. And we cover medicine, so both primary care medicine and most of the subspecialties of medicine. And then we have emergency medicine.
What are the subspecialties?
So subspecialties like gastroenterology, rheumatology, endocrinology, infectious disease, cancer docs. And then we have surgery, emergency medicine, dermatology, neurology, and urology. So we've all come together now under this common umbrella.
Are there any big ones that aren't in there yet you're scouting for? That sounds like most of what we think of as medicine.
Actually, there's a few specialties that are not in our group that are employed by hospitals. And so, think of things like pediatrics, anesthesia, psychiatry, pathology. But there are other freestanding foundations that are still out there that we're interested in partnering with to grow the organization and strengthen the organization.
Do you see Brown Physicians as being, there's another very large physician practice group owned by a large hospital company. Do you see these groups as being in competition, the way we talk about maybe with businesses that come on the show, or is it different when you're talking about doctors?
From my perspective, it's different when you're talking about doctors. We're all driven by being under Brown and being academic physicians, and I think we ultimately would like to see it all come together so we have one large practice plan that for the physicians that are affiliated with Brown, and we're aligned with the teaching hospitals in the state. And this is like a first step. When we made this decision, it wasn't to say, oh, we're going to go compete with you guys. It's the farthest thing from our minds. What we're trying to do is get a group of us together and go join with other groups so that we can be a truly full service, fully integrated group of physicians.
All right,
that's ultimately the goal.
We're going to take a break. When we come back, we're going to talk more with Dr. Caliendo about Brown Physicians and what's going on there, including specifically about Brown University's role in bringing all this together. Stick with us on Executive Suite. Welcome back to Executive Suite. I'm Ted Nisi. Later on in the show, we're going to talk about the homegrown company Granny Squibb and the iced tea they make. But first, we're going to talk about some more about who we go to when we drank too much iced tea. We're going to talk to Dr. Angela Caliendo. She is the interim executive director of Brown Physicians, Inc., which is a new umbrella group of physicians, about 500 doctors in various specialties and practices who have all come together. And Dr. Caliendo, you actually came, I think you came to Brown in 2013. You came to Rhode Island.
That's correct.
And we've talked before, I've talked to other doctors about how Rhode Island actually was a little behind in bringing doctors together like this, and you actually have out-of-state experience. Was that your perspective too when you got here?
Yeah, I was at Emory for about 14 years before I came up here, and we had a fully integrated practice plan down there. So every subspecialty, every specialty of medicine was all under one umbrella, and that was pretty typical for most academic medical centers. Now, whether those physicians are employed by the hospital or in a practice plan associated with the university or the hospital varies widely across the country. But I think the whole concept of bringing physicians together and physicians of multiple specialties together under one umbrella is well established nationally.
In other places.
Yeah.
Let's talk about Brown University's role here. So it's called Brown Physicians. I assume every doctor involved here is affiliated with Alpert Medical School, or at least most of them are.
Yes.
So what was Brown's role in bringing these 6 groups together and kind of creating this broader practice plan across the what had been separate foundations of doctors?
So Brown really played 2 roles. One was visionary, of having the vision, and Dean Elias and President Paxson really drove this.
Dean Jack Elias of the medical school.
Yes. And just to say, this is an idea whose time has come, that we want to strengthen the medical school. We want to get physicians more closely aligned with the medical school. Most of us that are here, most of the physicians that are here that have Brown appointments are here because of Brown. The academic mission is extraordinarily important to us, whether it's training the next generation of physicians or participating in research that's going to redefine the field of medicine and move medicine forward. That is fundamentally really critical to who we are and what our interests are. And so to have an opportunity to further align with Brown was one that we all embraced tremendously. And then we have Dean Elias and President Paxson on the other side really providing the financial support and the vision to how this could be designed and how this could work and driving the whole process forward for us.
Because so people understand the transaction, it wasn't that Brown bought these exactly,
no,
because they're nonprofits, but
right,
you needed money to kind of set up.
Right, and they're members of Brown Physicians Incorporated, so not only are all the physician foundations in there, but so is Brown, and Brown is represented on the board, but it's their financial support that is actually essential for this all to happen. None of the individual foundations had enough cash and reserves to be able to fund the whole process of bringing us together.
Historically, there were some complaints sometimes in Rhode Island's medical community about Brown as the institution with the medical school not playing a stronger role in bringing healthcare together, kind of pushing forward some of what should happen in the sector. It seems like there's been a change there in recent years with Brown kind of stepping up its involvement and its leadership role. Is that fair to say?
Yeah, and I would say a dramatic change. When I came 5 years ago, one of my first comments was, where's Brown? Where's Brown's role? I was very closely linked, accustomed to being linked to medical schools when I was down at Emory. Here I'm like, there seemed to be a gap, and that has changed dramatically over the last 5 years. And when you talk to physicians who have been here for a long period of time, for 15, 20 years, they're like, it's a new day, that we feel like Brown's involvement is at a completely different level than it's ever been before. And I think that's really important for the medical school, and I think it's also really important for physicians. It really helps us just come together and work better and do our job more effectively.
There have been so many changes in healthcare in recent years. The Affordable Care Act first and foremost, but you have hospital consolidation and changes in treatment, lots of different things going on, payment plans. If a student comes to you today and asks, should I go to medical school? Should I do it? Put all those years of study and all those hard. I always see those kids at the Starbucks on the East Side buried in those textbooks about anatomy or whatnot. What do you tell them today when they come to you?
Absolutely. It's a great profession. There's so much going on in medicine. It's changing, the technology, the advancements in the field. It is such an interesting and exciting field. I have young people come to me all the time at various levels of training wondering if this is a field for them, how can they find their area of expertise and their area of interest. And I would greatly encourage, the field needs young people coming in that are innovative, that are flexible, that are adaptable, that have that passion for patient care. And so I see it to be an outstanding profession. Don't come in if you're not prepared for change, because as you say, there's been a tremendous amount of change over the last decade or two, and I think we're going to continue to see that. Healthcare's in a period of chaos right now. It's happening nationally, and we will work our way through it, but we're not through it yet, and we don't really know what it's going to look like when we're done. And I think for people that are physicians that have relatively high-functioning analytical minds, it's a little disconcerting to not know exactly what it's going to look like when it's all over.
A little bit type A, maybe, if you were the doctors.
maybe just a little bit.
When you look out, especially also with your post in the Department of Medicine at Brown, where is the greatest need in terms of training in the coming years? Which specialties or which types of doctors do you think will be most in demand when you look at what the Rhode Island and the country needs?
Yeah, if you just look locally in Rhode Island, there's still a tremendous demand for primary care physicians. We just, as many as we hire, we can fill their practices up relatively quickly. And I think there are certain specialty areas that we probably could continue to grow and advance. But as we look at care more globally and trying to integrate care and drive costs out of care, the ratio of specialists to primary care, we're still short on the primary care side. And I think we have to find ways of encouraging people to go into the primary care track. And that's one of the reasons that Brown started the population health track in the medical school, was really to give a group of students a broader perspective on healthcare and looking at more from a population base and how to care for a population of patients with a disease, as opposed to focusing on one patient at a time.
We're just about out of time, but I have one last question. Most people watching today probably won't become doctors, but they'll all become patients or already are patients. What advice do you give? It can be intimidating to go to the doctor. What advice do you give to patients to be good patients and smart patients?
So the same advice you gave me before the cameras came on. Relax and be yourself. Go to the doctor and be yourself. Let them see who you are. Don't be afraid to communicate. Don't be afraid to ask questions. The more you understand about your health, the better off you're going to be in the long run.
All right, good advice for all of us the next time something's acting up and we don't want to go. Thank you, Dr. Caliendo. When we come back, we're going to talk to the folks at Granny Squibb. Stick with us on Executive Suite. Welcome back to Executive Suite. I'm Ted Nisi, and we are going to talk now about Granny Squibb. Neither one of these people are Granny Squibb. She passed away many years ago, but she's the founder of this company. They make iced tea, and they're homegrown in Rhode Island, and we're going to talk about that. We're here with Nick Carr and Kelley McShane. They are partners in Granny Squibb. Thank you both for being here.
Thank you for having us, Ted.
So, Nick, I'll kick off with you. As I said, Granny Squibb was an actual person, as I read up on the history. Tell us a little about the company and its backstory.
Sure. So, like you said, Granny Squibbs was a real person. She lived down in Saunderstown, in the 30s. And down there, she was brewing up this iced tea that had a lot of lemon in it, a lot of mint in it, back when cold tea was this strange new novelty. And everyone loved it. Friends and neighbors passed around the recipe. Everyone loved it, and they still make it the home brew down there today. And then about 9 years ago, her granddaughter founded the company, and everyone loved it so much, she said, we got to start bottling this stuff. So that started about 9 years ago, and then a little while ago, Kelley and I came on board. Robin built this great foundation for the company, and it was time to grow, and we're excited to be part of it.
So what, I know they said the key to this iced tea was it's amazingly delicious. There's a lot of iced tea out there. What did you guys, you guys have joined the company, you're clearly sold on it. What makes this iced tea different?
What makes it so great is that it's clean. There are only, 4 ingredients in the unsweetened iced tea. We have, it's black tea, water, lemon or lime, and mint. It's non-GMO, no preservatives, it's vegan, it's gluten-free, and it's delicious.
Are you worried that you just gave your recipe out on television?
No, we're a company we want to be transparent.
And Granny was passing the recipe out to everybody.
Oh, yeah.
Everyone in Saunderstown already knows how to make this stuff. Which actually, it's funny, when Robin started the company, she went through, I think, 50 iterations, and she would invite her neighbors down in Saunderstown to come over and try it. And they only went with it when they couldn't tell the difference between what was in the bottle and what they were making at home.
They were in the real thing. I love it.
Exactly.
Yeah.
So how, so as you said, they've been open, I think 2009 they founded, they started bottling it. How widespread are the products today? How many places can you find it? Where are they sold?
We're sold in Wegmans, in Whole Foods, in Dave's Marketplace, plus a slew of different local restaurants in and around Providence, Connecticut.
Yeah, Robin set up a really great sort of network distribution, some great relationships with a lot of those big stores. We're really happy to be in Whole Foods and Wegmans and Dave's. But we're excited also. We think it's a shoe-in for the local places. So we're excited to actually get out and get it in front of people where they shop.
And we have a lot of really fun collaborations happening and partnerships happening. So get ready for a lot of Granny Squibb sweet treats and barbecue.
So branching out a little bit there. So I'm curious so you have a couple of different flavors here that I said, mojito lime, I see lemon over there. What sells the best? What's the most popular?
Well, it's funny. Granny's original recipe is the sweetened lemon one. And we just assumed that was going to be the big hit, but they all do pretty much the same. Robin cooked up the mojito lime a few years ago, and that's doing just as well. So there's a market for it.
Yeah, and it seems to be pretty 50-50 on people who like sweetened and who like unsweetened. So,
how many are you bottling now? Can you give a sense of the scale of the operation? I mean, if you started out with her doing it in her kitchen, it's clearly much bigger than that now.
Right, so each run is about 1,000 gallons.
Wow,
so
that's a lot of tea.
Well, I mean, in the industry, apparently, is not that much,
True,
but
good
it certainly
point.
is a lot to us. So
right, and we were at the warehouse this morning, and they were like, the past few months it's been flying off the shelves. You're going to have to put in another order. We were like, yes.
So as you mentioned Nick, that you guys just joined the company recently. Tell me a little bit about how you got involved and what was the attraction. It sounds like it was partly a need to, onward and upward to getting another scale of size. But talk to me a little about that.
Sure. Well, it's a sort of typical Rhode Island story. The founder and Kelley and I are neighbors, and she was talking over the need that she has. She's running it all on her own, and it's time to grow. And Kelley and I saw it as a great opportunity for a brand that is sort of on the rise, but needs it a little extra push.
Do you guys have a beverage background? Is this a new business for you?
It's a completely new business for us. We both have backgrounds in communications and planning events and sort of developing recipes. But no, this is new, and Robin's staying on for a year to mentor us and help facilitate relationships with our distributors and our vendors. So
is it a little scary? We have entrepreneurs. I always like to ask entrepreneurs about jumping into something you haven't been in the business before. I mean, it must have been you looked at each other and said, all right, we're taking the leap.
Yeah, it's very scary. It's a big risk we're taking, but we're prepared for it. We're in it together. And we saw this incredible opportunity and thought, you know, we're 30, we're going to take it.
It's a brand that people already know and they already love it, and it's an opportunity to get it out there, and we really think that once you've tried it, you're going to come back to it. And Rhode Island, you know, they're really loyal. They love things from Rhode Island. You look at Dell's or Yacht Club, and we don't see ourselves as kind of competing with any of them. It's more sort of joining the team, and people really respond to that. So.
I wanted to ask you about that because I think of, you know, the beverage cases. There are I remember as a kid it felt like there was like you could have Coke or Diet Coke, maybe if they didn't run out of Diet, right? And now, you know, there's so many different drink options when you go to places. It seems like a very competitive space to be in. How do you navigate that when there are so many options people have right now? What are you thinking about that so far?
We are just getting out there. Our plan is to really do a grassroots jump, I guess. Anyway, but so it's to quite literally hand people the bottles and show people who we are and be accessible, and I think that that's going to go a long way for us.
Yeah.
Yeah, and there's, you know, it is a crowded space a little bit, but there are gaps in it, and I think we fill a good one. You know, I think tea a lot of times with the unsweetened, you try it and it's really, really healthy, but it doesn't really taste like much. Yes,
I've had that many times. This is medicine. Okay.
Absolutely. Or there's, you know, on the other end, there's sugar water that tastes really great, but it's terrible for you. And we, I think, fit right in the middle. It does taste really, really good, but it's not bad for you.
Yeah, how much, it's interesting, we've had a bunch of food companies on the last couple of years, and there's so much talk about the food economy in Rhode Island. There's the Eat, Drink, RI Festival just happened, where you see you guys were there. And how much, does that help being in a food business now than maybe 10 or 15 years ago, because there's so many? Is there a sort of a support network around being a food business in Rhode Island at this point?
Absolutely. And I think it is a little unique to Rhode Island because, you know, I think most people think of it as this really sort of sharky industry, but in Rhode Island, I mean, we were at the Eat, Drink, Rhode Island Festival, and we were talking with the guys from Yacht Club, and everyone seems to be really supportive. They want everybody to do well. Everyone's really proud of being from Rhode Island, and proud of. We're kind of spoiled with, for such a small state, the level of food and, you know, the restaurants and the James Beard Awards that are coming in the state. So everyone's been really great.
So what are you most excited about as you get into your first year running the place?
I'm just most excited about getting out there and sharing our tea with everyone. These events are going to be really, really fun. We have the next weekend in Westerly, we're going to the Misquamicut State Spring Fest. After that, we have PVD Fest, which we have a big surprise for, which is going to be really, really fun. And then we'll be down in Brooklyn for the Good Food Mercantile. And then we'll stay for the Fancy Food Show. And then, poor Nick, July, August, and September, I booked us for every barbecue fest, every seafood fest.
That's what you got to do. Hustle.
Yep.
We won't be hard to find this time.
I love it. Well,
we'll sleep in November.
Yeah, I wish you guys luck. And so it's 90 degrees today as we tape this, so it's a good day for a nice tea. Thank you both, Nick and Kelly, for being here. Granny Squibbs, you can find it in Whole Foods and Dave's and a bunch of other places. We'll see you next week here on Executive Suite.